Welcome to EASL Studio, your weekly hepatology broadcast news. In today's episode, we'll discuss what matters most, the questions every hepatologist should ask their patients. I am Pierre-Emmanuel Rautou, professor of hepatology in Paris, in France, and I am very happy to welcome to this studio Agnès Dumas, who is a sociologist in France, José Willemse, who is patient advocate from the Netherlands, Professor Zobair Younossi, who is a pathologist in the US, and Maria Hjorth from Sweden, who is nurse and is also part of the EASL task force on nurses. So welcome to all of you, and I would like to start with a very simple question, probably to you, naturally, José, which is, what question should we ask as a pathologist to our patients?
Yeah, thank you for asking or bringing up this subject. And besides, how are you? It's so important that doctors ask their patient at least once a year, what is the impact of your liver condition or your liver disease on your daily life?
Okay.
And that is a question that's really missed.
Okay, so simply, how are you is already, because you mean that it's not systematically asked by the physician.
Okay, but how are you is very important, but more
Okay.
important is the question about what is the impact on your daily life, because that's where people really want to talk about.
Okay, and yes, as sociologists, you are conducting, I think, many interviews to patients to dig into their perception of the liver disease for our patients. And what did the patients tell you?
Well, the patients tell me that they don't dare to tell things. So if the physician doesn't ask a question, they will not talk about the problems that they have, which can be quite debilitating. And the physician may ask, how do you manage? How do you need help? Because work can be impacted by the disease, also daily life activities. How is it going on at work, at home? Because you have people who are not supported, who don't have any caregivers, and they may be entitled to receive social benefits, social rights, and that's something that they don't really know, and hepatologists can help in addressing also these needs.
So by asking the question, José was mentioning what is the impact of the liver disease on your life. Maybe we'll open to the point you mentioned, the work, for instance, the family, etc. So, but Maria, in practice, how can we ask these simple questions? Because also there are possibly some time constraints. So how do you do that when you're with your patient, Maria?
Well, I actually think José and Agnès had good solutions. Just to ask, how are you, or what matters most, is quite a good opening question in a meeting. But we also need to give room for the patient's story, just not to interrupt. Because if we interrupt, the patient will feel neglected. And we want them to feel being taken seriously in the meeting and feel trust. So for the relationship, it's very important to listen to what they have to say. But I think we might be a bit stressed about asking these kind of questions and listening to the stories, if we might not feel that we are confident in helping the patient to solve the problem.
Okay, you mean we don't want to ask the question because we fear that we'll have no answer to provide to the patient?
Yeah, I think so.
Okay, we'll maybe keep this question for later, because maybe you have tricks to give to our audience, Maria. Zobair, but in practice, how do you manage this? Because during the outpatient clinics, we have to take care of transaminases, liver stiffness measurement, do the prescription, see the ultrasonography results. So how do you manage this on top of all the rest?
Yeah, I think all the our colleagues their points are very important. Physicians are not well trained in this kind of sort of approach. We usually focus on laboratory tests, things that are quote unquote we are trained in medical schools or in our residencies or fellowships. Look at radiology, biopsy, FibroScan, or fragile elastography sort of reports. But We fail to understand that from a patient perspective, it's how they feel and what they experience with their disease or treatment that's most important. So I think opening a question about, how this disease is impacting your daily life, your well-being, how is your experience with this disease or this treatment would be absolutely critical. And as you just heard, you shouldn't be actually leading the patient in terms of answers. This type of answer should come directly from patient. And sometimes you actually should do this without family members in the room. So you don't want to get sort of the perspective of the spouse or the parents. You want to get the perspective of the patient. It does take a bit of time, but it is probably the most important part of our clinical care. The other thing that's important is that, yes, we're stressed in time, but this is not going to take hours. This is going to take just enough so that the patient can communicate with you. Culturally important issues are really critical here. For example,
what do you mean by culturally differences?
So culturally, some cultures will allow sort of the individual to share their experiences pretty openly and easily. There are others that's not acceptable to do this. So you just need to understand that for example, I've had patients say from Japan, it's hard for them to. It's culturally not easy to discuss some of the sort of their well-being issues. While you have somebody from the United States, I don't think you'll have too much of a trouble getting that communication. So understanding that there are differences culturally, how to communicate and how to express their well-being is going to be very important.
Okay, so an open question to the patient, just like José was suggesting, what is the impact of your liver disease on your daily life? So, okay, imagine we do that properly. We ask the question to the patient. So what are they going to answer? Meaning, what is for our patients the impact of the liver disease on their life? Maria, what did the patient tell you?
Well, quite many mentioned first thing that they are having energy losses, to manage the social life outside work, for example, or feeling extremely tired that they need a rest.
Fatigue.
Yes, the fatigue. Yes, that's very often mentioned.
Okay. And José, what is your perception about this? Probably you discussed with many patients about their perception of their liver disease, and what information did you get from them?
Well, I totally agree with Maria. These are also the stories that people tell me, but there's so much more that even doctors don't want to speak about them, about libido, sexual problems. That's, and then I always say, but there are special doctors for it, that if your doctor has problems to talk about those issues. But not only that, they also struggle how to explain to the people in their surrounding how they feel and what their fatigue is, because everybody, and we all are tired too, but the difference is that we take, if possible, a nap and a cup of coffee, and then we are back on track. Liver patients not. And for people, it's so difficult to explain that to people, that their fatigue is really different from fatigue from other people, and they struggle with that. And at the end, they don't say anything, and they don't tell people that they have liver disease and what their problems are. And that's really an issue that it helps if doctors talk about that as well.
Okay, so fatigue is really a problem. The perception by the family, the surrounding about their fatigue, which is not understood, sexual problems. And yes, did you hear other complaints by the patients in your interviews?
Well, I totally agree with Marianne and José. Fatigue and intimate problems can happen. There are also pain and some issues about diet, nutrition, digestive comfort that is not well addressed. That's what patients say. And I think that by establishing an atmosphere of trust,